I'm Jasmine Kasai Fard, and I'm going to be talking about bronchitis. Bronchitis is the inflammation of the airways in your lungs, making it difficult to breathe, can causing coughing, mucus production, and wheezing. Bronchitis is classified into two main types of bronchitis, which is acute and chronic bronchitis. And acute bronchitis is a short-term inflammation of your lungs lasting anywhere from a few days to a few weeks, usually caused by a viral infection. And the other one is chronic bronchitis, a long-term ongoing inflammation of the bronchi, usually with a persistent cough and over mucus production. It lasts anywhere from 3 months to 2 or more years, so that's a pretty significant difference. Long-term exposure to irritants like cigarette smoke, pollution, chemicals, or dust can be a factor in getting bronchitis, chronic bronchitis, I should say. So yeah, the long-term smoking, exposure to other lung irritants, all from are causes of chronic bronchitis, or causes chronic bronchitis. And depending on the type of bronchitis, acute or chronic, it can be linked to different syndromes. So acute bronchitis usually is an upper respiratory tract infection, where chronic bronchitis can be known as COPD, or the chronic obstructive pulmonary disease, or emphysema. Signs and symptoms of acute bronchitis are the cough, chest discomfort, fatigue, fever, wheezing, rhonchi when you're listening to lung sounds, and mild shortness of breath, where chronic is very similar with that cough, mucus production, shortness of breath, wheezing, fatigue, and frequent reoccurring infections of the lungs. And I would say the most common tests done, diagnostic tests, are clinical evaluations like a physical exam. And expected findings would be the cough, wheezing. When listening to the lungs, you would hear rhonchi. A chest x-ray would be done to just rule out any other conditions like pneumonia. A sputum culture could be done to test for a bacterial infection of some sort. And then a pulmonary function test, and the expected result would be decreased lung functions, since it attacks the airways. Something that is an important differential diagnosis of bronchitis would be pneumonia, I would think. Both cause cough, fever, chest discomfort. However, in pneumonia, the symptoms are more severe, and it attacks or affects the lung tissue, whereas bronchitis affects the lung airways or the bronchi. And bronchitis is usually caused or set off by viral infection, whereas pneumonia can be caused by bacteria, virus, or fungi. So I would say that the two could be easily misdiagnosed if you weren't doing the appropriate testing for either one. Some complications that come along with bronchitis could be developing pneumonia, COPD, which would be more of the chronic bronchitis. Along with the chronic bronchitis, you could go into respiratory failure, having increased lung infections, so those reoccurring lung infections that you would see with the chronic bronchitis, and then pulmonary hypertension. Thank you.